If you've watched Dr. Berg's video on erectile dysfunction, you may have felt a mix of relief and confusion. Relief, because he offers what sounds like a clear biological explanation. Confusion, because the solution sounds far simpler than most men's real-life experience. Dr. Berg's central claim is that erectile dysfunction is not primarily a testosterone problem, but a nitric oxide problem. To be fair, that is partly correct. Nitric oxide is a real, measurable molecule that plays a critical role in erections. It relaxes the smooth muscle inside blood vessel walls, allowing more blood to enter and remain in the penis. This is not controversial science. In fact, this is exactly the pathway that drugs like Viagra and Cialis work through. So when Dr. Berg explains that erections are heavily dependent on nitric oxide, he's right. Where the video becomes misleading is when he frames nitric oxide deficiency as the central root cause of erectile dysfunction. In the medical literature, erectile dysfunction is not viewed as a single cause condition. It is typically the result of multiple overlapping factors, which may include hardening of the arteries, diabetes-related nerve and blood vessel damage, chronic inflammation, medication side effects, psychological stress and anxiety, depression, relationship issues, hormonal imbalances, prostate surgery or trauma. For many men, erectile dysfunction is actually an early warning sign of cardiovascular disease, not a standalone nitric oxide problem. Dr. Berg talks about nitric oxide almost as if it's a master switch. In reality, it behaves more like one piece of a very complex circuit. He also connects nitric oxide to a wide range of conditions: sleep apnea, asthma, cortisol, insulin resistance, and stress. These relationships are real in broad biological terms, but the way they're presented can be overstated. For example, he claims that nearly 80% of people with sleep apnea have erectile dysfunction. That number is significantly higher than what most peer-reviewed studies consistently show. There is a relationship, but exaggerating statistics without context creates unnecessary fear and confusion. Now let's talk about the solutions he proposes. Dr. Berg promotes several natural methods to restore nitric oxide: breathing through your nose, doing mild exercise, eating nitrate-rich vegetables like beets and leafy greens, avoiding sugar and alcohol, reducing stress, improving sleep. None of this is dangerous advice. In fact, it's good general health advice. The problem is the framing. These strategies support overall cardiovascular health, but they are not proven treatments for established erectile dysfunction. There is no strong clinical evidence that nasal breathing meaningfully boosts nitric oxide levels to the point where erectile dysfunction is reliably reversed. There is no high-quality evidence that beet consumption alone restores erectile function in men with vascular disease, diabetes, or nerve damage. These methods may help over time as part of a healthy lifestyle, but presenting them as a primary solution can create false hope and unnecessary guilt when they don't work. Another major issue with this video is what it subtly discourages: medical treatment. Drugs like sildenafil and tadalafil are not lazy shortcuts. They are extremely well-studied medications with strong safety and effectiveness data when used appropriately. They do more than manage symptoms. For many men, they restore normal physiological function by enhancing natural blood vessel responses, preventing men from seeking medical care by implying the problem can be solved with breathing techniques and vegetables is not empowering. It can be harmful. The real practical truth is this: nitric oxide plays a role. Lifestyle matters, diet matters, sleep matters, stress matters. But erectile dysfunction is often a medical condition, not a moral failure or simple nutrient deficiency. The responsible approach combines proper cardiovascular screening, diabetes assessment, hormone evaluation when appropriate, psychological factors when relevant, evidence-based medical treatment, and supportive lifestyle change. Not alternative advice instead of medicine. Dr. Berg's explanation sounds scientific, but it oversimplifies a very real and often serious condition. Good biology does not always mean good medical advice. And men deserve accurate, balanced information, not solutions that sound easy but rarely work in real life.